Good afternoon, everyone. I'm State Representative Cody Smith. I currently serve as the House Budget Committee Chairman. And today, Treasurer Fitzpatrick and I have been traveling the state hoping to inform voters about the budgetary consequences of Amendment 2 Medicaid expansion that we'll be seeing on the ballot next Tuesday, August 4th. Amendment 2 will add hundreds of thousands of working-aged, able-bodied adults to our already very expensive Medicaid program. And there are currently millions of dollars being spent across the state through a campaign in an effort to convince voters to vote in favor of the proposition. In that campaign, there are some critical details being left out, and that's what I'd like to hit on briefly today. First, this will be tremendously expensive to taxpayers. And second, there is no plan to pay for it. Recently, in a hearing here in Jefferson City, a Budget Committee hearing, the Department of Social Services, who oversees our state's Medicaid program, testified that they believe Medicaid expansion will cost taxpayers about $15 billion in the next 5 years. And much of that is federal funds, but the general revenue or state portion of that will amount in the hundreds of millions of dollars per year. And in Missouri, we have a balanced budget requirement, meaning that if we spend hundreds of millions of dollars more on Medicaid, hundreds of millions of dollars more on Medicaid, we will in turn spend hundreds of millions of dollars less on our other priorities like public education, public safety, transportation infrastructure, and our existing social services. So there is no plan to pay for this. There is no funding mechanism attached to Amendment 2. It would ultimately mean less money for kids, less money for police, less money for roads and bridges, and less money for those who are most in need. Proponents of Medicaid expansion say that it will bring our tax dollars back to Missouri, and they are implying that there are federal tax dollars being taken from Missouri citizens and sent out to states that have already expanded Medicaid. And this is absolutely not true. Missouri, like all other states, receive more in federal benefits and funds than we actually pay for in federal taxes. And this will not bring money home to Missouri. It will simply require more money to be printed in Washington, D.C. and added to our tremendous federal debt and deficit. And so this is bad fiscal policy on the state level, bad fiscal policy on the federal level. And for those reasons, I'll be voting against Amendment 2 next Tuesday. And so I want to thank the legislators that came out in support here, joined us here in Jefferson City. At this time, I'd like to turn it over to Senator Hageman. Thank you.
You bet. Thank you very much. I am Dan Hageman, the Senate Appropriations Chair. I had the pleasure of working with my House colleague, Cody Smith, on the budget. I, too, share many of the concerns that Cody outlined. This proposal has a critical flaw in my mind. It mandates us making payments without any new revenues or any way to pay for them included in the proposal. One point that I did want to point out as well, it also ties us and it binds the legislature by putting it in the Constitution. It doesn't give us the ability to change the program much from what is contained in the Medicaid already in January 1st of 2019. Basically, you have to stay at those levels. So if we find that this program is running out of control, taking up much more of our general revenue budget than what we anticipated, it also binds us. It doesn't give us the ability to adjust the program so that it does that, so we don't have to take so much away from higher education, from elementary, secondary education, from public safety. That's one of again, a flaw that I see in this program and a very concern that we have. Not only does it mandate the funding, and it's an entitlement program, and so we have to pay that, but it also ties our hands. It doesn't give us the flexibility to adjust it if we find it consuming more of our money. Those are some of the concerns that I have. I really worry that it does pit Medicaid population against our kids, and I think that's a great concern. So with that, Treasurer Fitzpatrick.
Well, thank you all for being here today. And as both of my colleagues over here have said, this is would put in the Constitution something that would bind the state of Missouri forever. And it can only be changed again by a vote of the people. When I got to the legislature originally in 2013, before I was state treasurer, I was on the budget committee my first term, and Medicaid expansion was a discussion that was taking place then, because as many of you know, and many Missourians know, this original idea was part of the Affordable Care Act, otherwise known as Obamacare. Ultimately, courts decided that the federal government could not force the states to expand Medicaid. We, as states, had to make that decision on our own, and that the federal government was not able to use our existing Medicaid funding, the threat of removing that, as a way to force states to expand Medicaid. At the time in 2013, when it was being discussed in the legislature, the estimated cost at that time was around $1 billion. It was expected that once the full funded federal portion of that ran out, and the state was responsible for 10% of that with general revenue funding, that the state would be responsible for roughly $100 million. Fast forward 7 years later, that estimate is now $2 billion. It's doubled in a period of 7 years, with general revenue being responsible for $200 million of that. It's almost certain to double again in the next 7 years, and then again in the 7 years after that. So I think what we need to keep in mind is that the numbers we're talking about today are today's numbers. And this decision is not just a decision for today, it's a decision for the future of the state of Missouri. We have between 900,000 and 1 million people on Medicaid. It fluctuates, with variations in the economy and things of that nature already. It's a very strained system that already makes up almost 40% of the entire state budget. What this would do, if it were to pass, would add up to another 300,000 people to that system that is already strained and is already consuming a massive portion of the state budget, as well as a massive portion of the state's general revenue spending. And what we're talking about is a population that is mostly able-bodied, working-age adults that we were talking about expanding Medicaid to. The state of Missouri already has very generous Medicaid opportunities for families with children. So if you're a child, if you have a family and you have children, and you're making less than 300% of the federal poverty level, which for a family of 4 is about $76,000, you can get your kids on Medicaid in the state of Missouri. If you're a pregnant woman and you need prenatal care and you don't have access to health insurance, and you're making less than 300% of the federal poverty level, you can get on Medicaid in the state of Missouri. The people that we're talking about, by and large, expanding Medicaid to are people who are working age, who are physically able to work, and in many cases are choosing not to for whatever reason. And that is a decision up to them. But I do not think that we need to be asking the taxpayers of the state of Missouri to pay for health care that comes with no premium, no deductible, no copays, no out-of-pocket expenses for people who are of working age and of able body that are choosing not to work. And the proponents of the proposal themselves say that, you're talking about expanding Medicaid to people that make less than $18,000 per year. In a few short years, the minimum wage in Missouri will be $12 an hour, I believe, which by itself, if you're working a minimum wage job 40 hours a week, you would not qualify for Medicaid, for even the expanded Medicaid. So what we're talking about is asking those people who are getting up every day, going to work 40 hours a week in a minimum wage job, to pay for, with their tax dollars, for health care for people who are choosing not to do that. And I believe very strongly that Medicaid is an important program that should be around for the most vulnerable people in our state, people with disabilities, people who are unable to work. And I think we need to preserve that, and I think we've done a good job at doing that. But you all know, as well as anybody, that the budget process in the state of Missouri is an annual tug of war between the growing cost of Medicaid and education. When I was budget chairman, my goal was to balance the budget, have some money left over for unplanned expenses, and fully fund the education formula. We were able to do that both the years that I was budget chairman. The legislators on either side of me have been able to do that since then. Obviously, we're in a historic situation with regard to the state budget, and that may or may not be able to happen this year before it's all said and done. But if we add another $200 million on top of the ever-growing cost of Medicaid, I can tell you from experience that it will likely be impossible to do that again. And it will be a continuous battle that is going to happen year after year trying to figure out how can we fund education. I've been asked, well, education's not the only thing you fund with general revenue. You're right, we do. We fund prisons, and if we want to close prisons and let violent criminals out of jail, that's one option. If we want to turn into Illinois and not fund our pension obligations, that's another option, and turn into a state with a junk credit rating. I don't think those are things that Missourians would support. And really, when you get down to it, one of the few discretionary items that we can decide how much money we're going to spend without substantial consequences to the state is on education. So that is why we talk about it in terms of, education funding. This is not a false choice. We have a limited amount of money. We are not a state that borrows to balance our budget. We cannot do that. We will not do that. And if it passes, the people on either side of me, working with the executive branch, are going to have some very difficult decisions to make that will get made, if it happens, but they'll have difficult decisions to make determining whether or not, how we're going to fund this thing. So I think it's important for people to know the facts, not just what they see on a TV ad. As Chairman Smith said, this is on the federal side. It's being funded by printing more currency. We have a $24 trillion. It's probably higher than that now. It's been a couple weeks, so maybe it's 25 or 26. I don't know, but it's a lot of money that we owe as a nation, and that's a problem as well. So I just encourage the people of the state of Missouri to consider all these things when voting next Tuesday. I'll be voting no as well. I'm happy to pass this off to any of my colleagues over here if you guys want to say anything, and if not, we can take questions if there are any. Anybody you want to speak on that? Go ahead.
Yeah, I'm State Senator Bob Onder from Lake St. Louis. I'm a practicing physician. And one thing I would point out is that 60% of the Medicaid expansion population already has health insurance, either from their employer or from the ACA exchanges. And those people will be thrown off of their private health insurance if Amendment 2 passes. So that's another unintended consequence, or maybe it's an intended consequence of this, because maybe part of this is to get more people dependent on a government program and further increase the reach of government into our health care. I don't think that's a positive development, though. I don't think that's something the people of the state of Missouri support. But I think it is wrong, it is immoral to throw 60% of people who do like their private health insurance that they have now off of their system for a government welfare program instead.
You want to say something? Come on.
State Representative Sarah Walsh from Missouri's 50th District. Here in mid-Missouri, we've got a lot of rural schools, and we have them all throughout the state. My greatest concern is going to be the impact that this is going to be on schools in the district. Millions of dollars just to District 50 alone. So that's my greatest concern. I will be a no on this, and I encourage folks to also seriously consider what's being shared today. Thank you.
Anybody else? Okay. We're happy to answer questions if anybody has any.
Have you talked to any other states that have faced the kind of problem that you're talking about? There are 37 others to choose from.
Yeah, there are states all over there having budget challenges. I think the state of New York is one example that's facing a tremendous budget shortfall, and the governor there specifically attributed it to the exploding costs of Medicaid. You look at other states that have done this. Illinois is broke. They're handing out IOUs instead of checks to pay people. There are plenty of states. We're a state that takes our financial responsibility seriously. We fund our pension obligations. We pay down our debt. We have a AAA credit rating. And we're one of very few states that can say that. Another thing that this does when it puts it in the Constitution is some of the other states that you might call conservative states that have expanded it have done it in a very different way. The constitutional amendment that we're looking at would prevent the state from ever implementing work requirements on the expansion population, like some other states have done. Other states have tried, private options and things like that. And so this is not the same as what some of these other states have done, number one. And number two, I think if you go to any, you might find very limited circumstances where it has not, caused the budget challenges, but for the most part, it will. And we're not a state like New York or California that annually issues a lot of debt. We hardly ever issue debt. And when we do, it's for very limited purposes like, building buildings or roads. and then we pay it off. And so, yeah, there are other states have had challenges, and we don't want to be one of them. Anybody else who wants to weigh in on that can, but.
Also, Washington University did a study or did an analysis that said this could actually save the state $39 million per
So there
year.
were a wide range of things in that study. That I read a good chunk of it, but there are things there are assumptions about the uptake. There are assumptions made about, and when I say uptake, the number of people who would actually enroll, which in really every case has been more than has been expected when you look around the country. There's assumptions made about being able to shift populations that we're already covering into the 90-10 match, which I don't believe is a likely outcome. There may be a little bit of that, but it's not going to be a broad thing that occurs. And so even that in that study, I think it has a range of savings to a cost. I mean, it's, there is and I would look at it as a budget person and somebody who has to deal with the finances of the state, is you always have to assume the worst case scenario. When you're planning financially, whether it's in our personal lives, in our businesses, or as a state government, you have to plan for the worst case scenario. And that's, I think, what we need to be doing. But I think, do you want to say anything on that?
Yeah, one thing I would add, the so-called WashU study was not a study, it was a white paper. Basically, it was an advocacy piece that, as our treasurer pointed out, made assumptions, made lowball assumptions on uptake, lowball assumptions about cost per beneficiary. And it was bought and paid for by a known Medicaid expansion advocate. So I don't think the white paper is as good as the white paper it's printed on. I would point out that the average Medicaid expansion state has seen cost overruns of 154%. That's real world. Those are real world numbers, not made up numbers for purposes of passing a constitutional amendment. And finally, as Treasurer Fitzpatrick pointed out, Governor Cuomo not only blamed Medicaid for his state's budget woes, but specifically blamed Medicaid expansion for New York State's budget woes and questioned whether it would be sustainable. We don't want to get into that situation in Missouri. I'll be voting no, too.
Yeah, can we expect any solutions from the upcoming legislative session in regards to rural health care in Missouri? We've had at least 7 different hospitals close over the last decade in Sweet Springs and Boonville most recently. What do you say to those folks and telling them to turn this down in terms of bringing health care back to their communities?
Well, I'll be brief on this part, and then I'll let legislators jump in because I'm not in the legislature. But, Medicaid expansion is billed as like the silver bullet for financial problems for struggling hospitals. And I frankly don't think that it is. I mean, it might help a little bit, but frankly, there are hospital systems out there that have problems that exceed what Medicaid expansion itself can solve. I know that there has been just a tremendous amount of funding that's come down through the CARES Act and other sources from the federal government to support rural hospitals through the pandemic. We have at the state level a program specifically designed in the CARES Act appropriations the General Assembly made that will provide funding to rural hospitals. So there are other sources of funding. Rural health care is an issue that it goes across the country. It's not just in states that haven't expanded Medicaid. In terms of what happens in the legislative session, if there's anybody who wants to comment on that, I know that budgetarily, it's
primarily in states in the southeast which have not expanded Medicaid.
I think if you look across the country, you're going to find hospitals that have financial struggles in states that have and have not expanded Medicaid. So there may be some in the southeast that have problems, but there are parts of rural America that are shrinking, and so when you look at that, I mean, there's that can be a challenge for hospitals that isn't just going to be fixed by Medicaid expansion. But I know that as the budget process goes, hospital funding is at the forefront of it in the budget every single year. And these two gentlemen right here and their colleagues on those committees work through that every year. And generally speaking, the funding to them goes up every year. So, I'll let them weigh in and these folks weigh in on the legislative side of it.
I just want to weigh in briefly. I'm State Senator Dave Schatz from the 26th Senatorial and also the President Pro Tem of the Senate. I come from a district that I have rural hospitals that have the scenario you've described that find difficulty as well. But I can tell you this, that the Medicaid situation, if all their patients were Medicaid, they couldn't survive on the reimbursement rates that are there. It's not the answer. It will help them in some of their uncompensated care, but this will not solve their problems. We have other problems that we need to address. Again, I'm not an expert on exactly how we fix the problem, but I do know this: Medicaid expansion is, I do not believe, is the answer. I will be voting no on this measure myself as well. I trust the appropriations folks that we have in place, that we've looked at the numbers, and you have a choice. You can choose to expand Medicaid, or you can choose to take it away from education, because that is the choice that you're faced with.
Yeah, if I could say one more thing about the plight of rural hospitals, and it is true, as Treasurer Fitzpatrick pointed out, hospitals have closed in Medicaid expansion states too, there's no question about it. Specifically here in rural Missouri, one of the biggest problems for rural hospitals is that there are fewer people living in rural Missouri than there were 70 years ago when the federal Hill-Burton Act incentivized construction of hospitals. I would also say that one of the biggest problems for rural hospitals is that they are having a hard time competing with the large hospital systems, your SSMs, your BJCs, your Coxes, your Mercies, and your university hospitals like Mizzou that are funding this Medicaid expansion effort. Those large hospital systems are convincing people that when you have health problems, the expensive, profitable health problems like having babies or having joint replacement surgery or having cancer treatment, that you should go to the big hospital system where you'll get, quote, better care. So again, it's I think quite two-faced for some of these hospital systems to say, you should expand Medicaid so that you can help these rural hospitals, when one of the biggest problems is those rural hospitals are having to compete with the urban hospitals. That's not something Medicaid expansion is going to fix.
I have a question for Treasurer Fitzpatrick and also for Chairman Smith. In terms of polls, I haven't seen anything recent, but what are you hearing, particularly in rural Missouri? Are you optimistic that your side will win this election?
Well, I think, number one, when you look to Oklahoma passed it by 0.5%. On election day, it lost by, I think, 10 points, and it was really won with absentee ballots. So I think Missourians, when you look at the history of the ballot box in Missouri, that Missourians are skeptical, right? They don't vote for tax increases, even when the polls say they're going to. Polls I've seen have this in the low to mid 50s at best, and so I think at the end of the day, it's really going to determine on the quality of the pollster. I don't know. I'm not a pollster, but all I know is, in the past, when we predicted things, similar, like tobacco tax increases, things like that were going to pass, they didn't. And frankly, I think a lot of Missourians are smarter than a lot of people give them credit for, in that, they're going to look at this, and most people are going to realize there's no such thing as a free lunch, and that includes Medicaid. Somebody's going to have to pay for it, and I think they're smart enough to realize it's going to be them. And so, look, I think it could go either way. It's going to be very close, in my opinion. But it's, history will be the judge of it, I guess.
I concur with what Treasurer Fitzpatrick said. I think it is going to be close. I come from Jasper County, which is a very conservative part of the state. Most of the folks I talk to down there think that this is a very bad idea. I think it's mostly about informing voters as to what's at stake as far as the overall financial health of the state, and that's what we're here doing today. So the more we can do that, I think the less likely it is to pass, but we shall see. Thank you all. Is that everything?
Any others?
Okay.
All right.
Thank you very much.